everybody, it's Paula here from Ohana Therapeutic Massage, just coming on to share a little bit more details about what a typical myofascial release session looks like. And as you may know, I specialize in the John Barnes approach to myofascial release, which is in many, many ways more aligned with like physical therapy type of manual therapy that rather than traditional massage therapy with the kneading and the pushing and that kind of stuff. And so because the nature of the work that we do is a little bit different, that also means that the structure of the session is quite a bit different than a traditional massage. And so the first thing that I like people to be aware of is that rather than getting like undressed and going underneath the sheet and the blanket like you normally would with a traditional massage, with John Barnes MFR, I have you wear like a tank top and shorts, for women, or two-piece swimsuit, sports bra, shorts. Boys or men can usually get away with just wearing shorts. But that way it allows me to kind of see where your body's at and seeing all of those visual cues that your body gives about different pain and dysfunctions and stuff like that, rather than trying to like move the blankets around to see things. And if you're somebody who gets cold easily, don't worry. I keep my room at about 85 degrees so that you don't get chilled when you're trying to relax on the table. The other thing is once we bring you back into the room, we do our normal health intake. How are you? Where's the pain at today? What are we looking for? What are you trying to achieve out of your sessions with me? Because that gives us kind of a baseline of where you're at. And then I do a standing visual assessment. So I take a look at you when you're standing in gravity so I can see visually where is your body being pulled out of place. Because a lot of times we don't necessarily see those things in our own reflection if we look in the mirror, but you might be standing there and I can see that you have one shoulder that just sits just a little bit higher, meaning that either up here is really, really super tight or down here could be really super tight and causing you to be a little bit off balance. After we do, I jokingly call it the full police lineup, where you look at me, you rotate 90 degrees, you look, and then I look at you, you rotate 90 degrees, I look at how your back and your spine is sitting on the posterior side of the body, and then we do it again. Then I have you come onto the massage table, and again, you're just laying on top of the sheets and stuff, and then I check your leg length, as well as your hip bones where your ASISs are sitting, to see if there might be some sort of rotation or upslip or something like that going on. Because a lot of times if our pelvis is out of place, it can shift and make our entire spinal column go out of place in a compensation pattern. And so from there, so we do a little bit of assessment, a little bit of talking, then from there we start with usually the area that's either causing you the most pain, or the area that's being pulled off center the most. And that allows us to sink into that kind of major problem area and see where else in the body that major issue area might be playing at. And then from there, in many cases, we play follow the symptoms. So sometimes when I'm doing a release, if I'm doing a psoas release or something like that, where I'm sinking into your tissues in your abdominal area, you might feel that in your shoulder. What that does is it tells me that your hip issue and your shoulder issue are related. And so in order to effectively release one, we have to release both in many cases. And so we just kind of meet your body where it's at, put your unique puzzle pieces together, so that we can work with your body to get you the best relief possible. So if you're interested in scheduling one of these sessions, or if you have any questions, comments, or concerns, feel free to put them in the comments below. Otherwise, you can give us a call at the office at 218-263-1501, or you can check us out online at www.ohanatherapeutic.com. Thank you for joining me and have a fabulous day.